Complete Health Dentistry.
Good morning, and welcome to Complete Health with Dr. Mike Rogers. I'm April, and I'm here today with Dr. Rogers to discuss mouthguards in sports. Good morning, Dr. Rogers.
Good morning, April. How are you?
I'm doing well, thank you. Can you start by telling our listeners what is a mouthguard?
Well, a mouthguard is a soft, plastic, cushioning device or appliance that's worn by the athlete or the person using it between the top teeth and the bottom teeth to help protect the teeth.
And who should wear mouthguards?
Well, anyone who is in contact sports, any age, even non-contact sports, I recommend them for. There's a multitude of times that someone could get injured in the face. So many sports activities should be covered by wearing a mouthguard.
Okay, well, what type of sport should you wear a mouthguard for then?
Contact sports that we know of: hockey, lacrosse, football, rugby, field hockey, karate, things like that. That's all contact sports where you're going to get hit or traumatized to the head and neck, and you really want to cushion that blow. The ones I also recommend for are non-contact sports, so ones we don't really consider as a contact sports, such as basketball, baseball, softball, volleyball, even gymnastics. And then, things that are outside the realm of it that you look away from, and you think of skateboarding and mountain biking, as well as climbing, and as I mentioned earlier, gymnastics as well. And the thing is, with baseball, people go, well, I don't need, how is that a contact sport? Well, one, when you're at the plate, you could get hit. There have been kids that got hit this year that I've seen where they've got hit in the face by an errant pitch and created trauma. The other one is infielders. When the ball is hit directly at them, if it takes a funny bounce, a lot of times it's coming right up in their face. And
Ouch.
I've had kids come into my office with damaged and broken teeth because of that. So even baseball, when you're especially infield or up at bat.
What about boxing?
Boxing's a big one. Once again, a very contact sport where the whole point is trauma to the head and face. So I mean that there too, just like karate, it's a big thing.
And also it made me think of weightlifting. Do you need to wear it when you lift weights?
Oh yeah, that's a big one. The weightlifting, because you put so much stress when you're straining to lift that weight or to go that extra mile. You put a lot of stress on teeth that could crack or fracture. The cushioning aspect of that will spread the forces of that pressure out over the teeth and help prevent any one tooth from taking that trauma.
Well, that makes sense. So why should you wear a mouthguard when playing sports?
Well, mouthguards prevent chipped, broken teeth and knocked out teeth. It helps protect the lips, the cheeks, the tongue, the gums, the jaw. It helps redistribute the forces from a blow to the head or neck. And it won't prevent concussions, but it can help minimize the severity of the hit or the blow and help minimize the symptoms of concussion if you're wearing it.
Wow, it sounds like it's a very important part of the uniform.
It is. It is a really important part. It should be a part, just like any other part of any uniform, should be start with a mouthguard.
Are there different types of mouthguards?
Yes, there are. There are basically three different types of mouthguards. One is a stock or preformed mouthguard. It's kind of like one size fits all. April, when we first got married, I went out our Christmas. We spent time together, and I went out and got you the perfect gift. And you know how well one size fits all works out. I don't know if you want to tell that story. I bought her a dress that I thought was great. One size fits all. It does not work real well. And I found that out afterwards. The other is what they call, those one size fits all. can be very bulky and cumbersome and just hard to function with because they're not made specifically for that person. The next type is...
Where do you get a one-size-fits-all?
A lot of sporting goods stores have them.
So those are just like over-the-counter type thing?
Over-the-counter, exactly. Okay. The next one is boil and bite guards, where you could get them, same thing. They're one step above. They're a little bit more form-fitting because you actually put them in hot water, soften it up, put it in the mouth, and just as it says, you kind of bite into it and form it around the teeth a little bit to customize it a little, but it's not really a custom mouth guard. It'll be better than the stock one. And then lastly, there's custom made just for you that are more comfortable and form-fitting. The dentist, we will take molds of the patient's teeth and actually form fit the rubber right onto the mold and custom make it, fine tune it and trim it just to fit comfortably in the athlete's mouth.
Oh, okay. So the custom fit then has to be done right at our office.
Yes, it does. And like I said, there's a series of steps that are involved in making a custom fit mouth guard as opposed to the other types of mouth guards that are out there.
Okay, so I've seen, in high school sports, the mouth guard attaches to the
face mask of the helmet.
Yeah.
Yes.
So that would be the stock one, right?
It could be stock. It could be the boil and bite, and it could also be a custom made one. We can add that if the athlete wants that, so that it can attach to a face mask or a helmet. We can certainly add that to the unit as well.
Okay. All right, you are listening to Complete Health with Dr. Mike Rogers. When we come back, we will discuss the advantages of custom mouth guards.
Complete Health Dentistry.
As we begin a new sports season, Dr. Mike Rogers of Complete Health Dentistry of NEPA is reminding athletes of all ages of the importance of wearing mouth guards. Mouth guards are used to protect your teeth, gums, lips, and jaw from injury and help redistribute forces from a blow to the head, preventing a lifetime of future dental problems due to broken or knocked out teeth. A mouth guard should be worn even if you wear braces. To support our local sports teams, our office will be holding several mouthguard clinics. You can get a custom-fitted mouthguard for only $45. Just mention this commercial and the sport you play. These mouthguards can be made with your school colors. Call our office for more information and to reserve your time. 570-253-5000.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Before the break, we were talking about the importance of wearing mouth guards during sports and also the different types of mouth guards available. Dr. Rogers, you recommended the custom-made mouth guard over the other types. What are the advantages of using a custom-made mouth guard?
Well, custom-made mouth guards are much more comfortable, and they fit more closely or adapt more closely to the teeth themselves. They fit in more securely, and it allows the athlete to be able to breathe much better, more normally, and communicate, be able to talk, because it fits almost like a second skin on the teeth themselves. Custom-made mouth guards can help prevent damage to the teeth, the gums, the soft tissue, the lips, the tongue. It can help prevent concussions better, and even some studies show that it can eliminate the problems with improper bite and how the body relates to that, and it can actually enhance performance.
Are you saying like a store-bought, those...
Boil and bite?
Yeah, the boil and bite, and then the other one. So is there more of a chance of that coming out? So if you're playing football and you get tackled, can that pop out and then you lose that protection, whereas the custom-made is form-fitted to your teeth, so the chances are less?
Great question. Yes, it is. It is. It's as we were just talking before, one size fits all. You know, if you've got little Johnny who's only 80 pounds and you got Pete who's 180 pounds and they both got these one size fits all, it's not going to fit them both the same way. And so in one person, it may fit pretty close. The other person, it's going to be way too big.
Hence, the one size fits all does not work.
Exactly. Exactly.
What kind of injuries can occur if you do not wear a mouth guard during sports?
Well, I'm going to hit you with some statistics first, okay?
Okay.
The National Youth Sports Foundation for Safety estimates that an athlete is 60 times more likely to sustain a damage to teeth if they don't wear a mouth guard. And it's estimated that about 3 million teeth are knocked out per year.
Ouch.
In the athletes that are playing sports. The American Dental Association estimates that mouth guards prevent problems in over 200,000 cases of trauma to the face. And so it is a preventative measure that we can see not wearing one increases the likelihood of having damage, permanent damage, and then wearing them can prevent permanent damage. Types of injuries that occur can be fracture to the root, the tooth, or even just as small as a chip. And once again, any one of those are permanent damage to the teeth themselves. Avulsion, and what that means is the whole tooth gets knocked out. And then
you see that a lot in boxing and ice hockey, right?
Hockey, yeah. And then lastly is luxation, and there's 3 types of luxation. One is extruded, meaning the tooth looks longer. It's kind of pulled out of the jawbone a little bit, but not completely out. It looks longer than the other teeth. The other is intruded, where it's forcibly pushed up into the bone, and it looks shorter than the other teeth. And then a lateral displacement, where the tooth is either pushed in towards the mouth or pulled out from the mouth, and so it's displaced or out of alignment with the rest of the teeth. And all of these injuries should be addressed as soon as possible.
So these injuries then are permanent too, or can anything be done if your tooth looks longer or shorter or is pushed in?
Yes, in a tooth injury, you should get the patient or the athlete to the dentist as soon as possible. The quicker you get them there within, say, a 2-hour time period, the less likely permanent damage, say if a tooth is pushed in or pushed out or pushed forward or back, or even if it knocked out completely and put back in, you're still going to have permanent damage of one way, shape, or form, but it's going to minimize the amount of damage that's going to happen.
If I have a tooth that's knocked out, you can actually put that back in?
Yes, we can.
Wow.
And so in those cases, what you want to do is you want to get them to the dentist. For a luxated tooth, meaning a tooth that's shifted somewhere in the socket, it's still in place, you have the athlete keep a light pressure, not on the tooth itself, but just so they're able to close, but just position it so it's not going to wiggle or move anymore. And then you want to get them to the dentist as soon as possible to address that particular situation. If a tooth is knocked out, then what you want to do is you want to find the tooth. You want to pick up the tooth by the crown of the tooth, the visible part. You don't want to handle it by the root. If there's dirt or debris on it, you want to flush that off. And then if everything's cleaned off, you don't want to scrape that. You don't want to scrape it off. You just want to rinse it off with water. If everything looks clean and you can put it back in, then put the tooth back in as best you can and get it to seat as best you can and get the patient or the athlete to the dentist as quickly as you can. If you can't put it back in for whatever reason, then saturating it in say gauze with water or saline would work. I've had patients bring it in tucked underneath their tongue to keep it bathed in
I've heard you can put it in milk. Is that like an old wives' tale? Or
no, milk can help too. Milk, if you've got that available, you can certainly put it in a cup of milk. And just like even with a fractured tooth piece or a broken tooth piece, these same scenarios run true with that. For broken teeth and for teeth that are avulsed or knocked out completely, they do make a special solution that can be used to transport the tooth to the dentist. Now,
that would be something really handy to have in their first aid kit on the field.
Yes, it would be. The other thing that can happen is if there's fracture to a jaw or bone, that you need to get to the emergency room as soon as possible. If there's severe laceration of the tongue or the cheek or the lips, once again, seeing someone who can address that in the emergency room. For seeing a dentist, most times it's tooth related.
What great information. That's also really great for coaches to know and parents to know if their athlete has any kind of problems like that. So moving on, can you wear a mouth guard with braces?
Yes, and athletes with braces should really consider a dual arch or a top and bottom arch covering appliance. And what that does is it protects, because if you get hit in the face or the mouth, the brackets or bands can actually impale or get caught on the soft lining inside the mouth, inside the lips, or damage the lips. So if you've got brackets and bands on the both top and bottom, you need to protect both top and bottom. And so those type of mouth guards are available that you can make them to protect that. In fact, a couple of years ago, we were skiing and at Blue Mountain, and there was a young lady who face planted, and she wound up impaling her lips into on her orthodontic wires and brackets. And so it was something. When we got to the emergency station, they had paged and asked if we could help. And we went there and were able to dislodge her lip from her brackets, but we still got her in to see an emergency room physician afterwards.
That makes a lot of sense. I recently had braces, just got them off last year, and just bumping your mouth can cause some trauma. Yeah, so that's a great idea then to make sure that you have one on the top and the bottom. So when you have when you don't have braces, where do you wear that mouth guard?
Well, most people find it most comfortable on the upper arch, meaning wrapped on the top teeth, because it protects the top ones. They're a little bit wider than the lower ones, so it protects them. Other people like having the security of added lip, like a lip bumper or a lip protector as well, outside the mouth to help protect the lips. So now there's an extra layer of protection there too as well. So things like that, you have to just evaluate and discuss what position are you playing. If you're in a sport where, like a quarterback, you want something that you can talk with and you can enunciate and call signals and things like that. If you're say you don't have to do that, and you want your lips protected, or you need something to protect braces, then yeah, we can make those as well.
What if you have Invisalign, the clear braces that go over there? They look like mouth guards. Can you use those as mouth guards? No,
you shouldn't. Anytime you have an appliance of any sort, whether it's a retainer, whether it's a clear invisible brace, and that's a great question, because an invisible brace is a hard plastic material. It's not soft. It's not going to be able to absorb that impact. It's going to be almost like tooth on tooth hitting. And so you're going to be more apt to damage the teeth. You're going to have more trauma to the jawbone. You're going to be more likely to sustain a concussion. So anytime you have, say, a hard retainer or hard something like that, you want it removed and a soft mouth guard made.
So even the retainers that have that single wire that goes across the top teeth.
Well, yeah, that too. You should take any plastic or any metal that's in any removable appliances, retainers, partials, things like that, you should take them out of your mouth, because what happens is, one, we can make an appliance or a mouth guard to go over them, but what happens now is it makes it more bulky, it's less secure, it's going to be more cumbersome and less likely to be worn. The other thing is, if you get hit hard enough and that appliance breaks or cracks, well, now that you've got this sharp object that could jam up into the roof of your mouth, your cheeks, your tongue. It could do a lot more damage having this sharp chunk of plastic or metal that now is damaged, causing problems.
We are here with Dr. Rogers discussing mouth guards in sports. When we come back, we will discuss how you can get your own custom-made mouth guard. It's easier than you think.
Complete Health Dentistry.
A whiter, brighter smile looks great on everyone. It not only improves your appearance, whiter teeth can make you look younger, healthier, and more vibrant. It sure complements a golden summer tan, too. And if you have a wedding in the near future, whitening your teeth should be in your plans. For the month of July, Complete Health Dentistry of Northeastern Pennsylvania is offering $100 off in-office whitening or $25 off our take-home whitening. Dr. Michael Rogers welcomes new patients and extends this whitening special to everyone. Call for an appointment today, 253-5000. It's a great way to boost your confidence. And with the special discount this month, now is the perfect time.
Complete Health Dentistry. Transforming your health for a lifetime.
Visit us on the web at CompleteHealthDentistryofNEPA.com. Welcome back to Complete Health with Dr. Mike Rogers. Doctor, do you have any helpful hints on what to look for in a mouth guard?
Yes, don't just go by, it looks great, or it's got a great name on it, or something like that. What you want to look for, an effective mouth guard should be comfortable. And what I mean by comfortable is the child or the athlete themselves don't have an issue with wearing it. It's not bulky. It's not out of sorts or creates problems functioning. They're actually going to want to put it in their mouth to help protect their teeth because it is so comfortable. It should be durable. And what I mean by durable, it should last through the season itself. It should be easy to clean. And it should allow your child to be able to communicate effortlessly. And it should also not impair their airway. And what I mean by that is if it's so thick and bulky like a stock or a boil and bite, what they're going to wind up doing is limit how your child has to breathe. And so you want something that's more comfortable, that more form-fitting, so that they can breathe much better.
When should you replace your mouth guard?
That's a great question. You should replace them. You should replace them when you see that they're worn, damaged, or ground through or worn right through. That should be one. At the start of a new season, every new season you should start with a new mouth guard because bacteria can grow on it. You don't want to just pull it out from last year and go for a new one. The other is if it's a younger person, as they grow and develop, their mouth is changing from, say, baby teeth to a mixed dentition where there's adult teeth and baby teeth in there to all adult teeth. So along the way, as they're changing, you should change the mouth guard as well.
So like if it's too tight or you feel like it's pulling your teeth in ways that it shouldn't be, kind of thing?
Well, not so much too tight or pulling because it's a soft, flexible material. But what it is it's not going to fit as accurately if it's made for a bite where they were baby teeth and now there's adult teeth. It's not going to fit properly.
Can you discuss how to take care of a mouth guard?
Okay, the first thing you want to do is after you wear it is rinse it with cold water, and keep it transported in a hard case. Don't just hook it to the face mask or put it in your pocket. It should have some type of case, such as a retainer case or something, so it doesn't get damaged. When you get home, you should brush it down with toothpaste and toothbrush, and then rinse it with cool water. You should never rinse it with hot water because it's soft and flexible, so it could damage it and change the shape of it. You should never let it sit in a hot vehicle. because once again, it could change the shape and damage it. The other thing is that people don't think of is you don't want it left out, and that's where this hard case comes in play, is you don't want it left out because pets look at these as chew toys. They got all our slobber on it, and it looks good, smells different, and it's soft and rubbery for them to chew on. And so you want to keep it out of the reach of pets. And then, as I said earlier, just keep them stored away from anything in high temperature.
Would you soak them in like a retainer cleaner or a denture cleaner?
No, I wouldn't. I don't recommend that. One, because it's a soft, flexible material, and that the retainer cleaner or denture cleaner can actually soak into it, and then you're stuck tasting that.
Oh. Are there other uses for mouth guards?
Well, we use them in other aspects of dentistry. For people who clench and grind their teeth at night, we can make a mouth guard or a soft guard to help protect the teeth from any further damage. It'll protect the teeth from damage to clenching and grinding. It'll protect the jaws and the gums. So it'll kind of cushion that if you clench or grind. The other time is if you know there's stressful situations in your life. You know, for example, when I drive into New York City, the aggressive driver comes out at me, and I probably should have a mouth guard in it because I clench and I really grip my teeth when I'm pulling the Mario Andretti, so to speak, weaving in and out of traffic. But there too,
I think I should have one as the passenger.
There you go, as passengers in vehicles. You know, and that kind of brings me back to what we were talking about before. I was just thinking as non-contact sports that we don't think of. You know, with all these activities at ski slopes now, with the rails and you know, where the kids do jumps and ride their skis on it. Anytime you do activities like that where you can fall and hit your face, you really should have a mouth guard. I've seen it routinely every year, annually, from baseball, where you don't think you're going to have injuries, to skiing. You know, you can make these custom-made mouth guards that are almost very comfortable and very invisible to a certain extent, and it's not hindering what you're doing.
Another thought I had, it may sound a little overboard and unnecessary, but jumping on the trampoline. We have treated many patients for injuries on the trampoline. If you're jumping with others, we've had some collisions where actually teeth have been knocked out and the other person has needed stitches in their head because they collided. So mouth guards on the trampoline would be a good idea also, wouldn't it, Doctor?
Yes, it would. And once again, you don't think of it when you're out there having fun, but if you're doing it routinely, you should really have some protection in that respect as well.
Doctor, do you have any final words for our athletes out there?
Yes, make the mouth guard part of your uniform. Wear mouth guards not only in the game when you have to, but also on the practice field. I had a friend of mine when I played lacrosse in high school. He actually was on the practice field and got hit and actually bit a piece of his tongue right off. Ouch. And so it's not just the game, it's the practice as well. It's got to be part of the uniform. Sideline or bench any sugary drinks, especially when you're wearing a mouth guard. If you're drinking sports drinks or fruit juices or things like that, when you've got a mouth guard in, those mouth guards will hold that liquid in there, and it will act like a big swimming pool of sugar and create cavities on your teeth. So once again, you don't want to be drinking these. Water's best. And if you do drink any of those, don't drink them with a mouth guard in because it can hold the sugary stuff next to your teeth. And then brush, floss, and repeat.
Okay. Doctor, if someone is interested in a custom-made mouth guard, how could they get one?
Great question. We're going to be having some clinics over the next couple months where you can get a custom-made mouth guard in our office for $45. And we will take the molds. We will fabricate a mouth guard for you or your athlete. It could even be made if we've got your school colors available. We can make them in your school colors. Call our office for more information, 570-253-5000.
Thank you so much for listening to Complete Health with Dr. Mike Rogers. To listen to this show and all of Dr. Rogers' past shows, visit our website at completehealthdentistryofnepa.com.